So you recall from your first person on scene training that catastrophic bleeding takes precedence over everything else within the primary survey. Some vital ingredients to managing catastrophic bleeding will include combat application tourniquet, emergency bandage and hemostatic agents. Catastrophic bleeding is bleeding that, if not controlled, is likely to cause a fatality. So primarily we're looking at stopping that bleeding prior to doing anything else.
Stand down.
Using the combat application tourniquet is extremely simple. It's been proven and effective to save many lives within war zones. Primarily was designed for the person that injured themselves to actually apply it. Obviously, as a responder, we would like to apply that to our casualties. Sighting the tourniquet is extremely important. So we're looking to place the tourniquet as quickly as possible, around about 5 centimetres above the wound site, and then tighten it as such that it then stops the bleeding. This can be extremely painful, but hopefully will be effective. Hemostatic agents are designed to assist the coagulation of blood. This assists the person in not dying from hemorrhaging. There are many different types of hemostatic agents. We favour Celox. Celox is an impregnated gauze. This is used directly at the wound site by packing out and cramming in the gauze actually into the wound. You will have to follow the instructions on the side of the packet, which indicates with Celox we need to apply pressure for up to 3 minutes. It's quite a long time. We usually use a bandage to secure that in place so then we can move on with the rest of our primary survey. Emergency bandages have been designed to provide active compression upon a wound site. They are significantly more effective than normal first aid at work bandages. They're designed as such that with a plastic ratchet that we can apply further existing pressure directly to the wound site. If an effective tourniquet has been placed and a hemostatic agent used, the chances of bleed through on these bandages should be minimal. Once you've moved through your primary survey and we get to the reassessment phase, it's absolutely vital that we look at the wound sites. If the wounds are still bleeding, then we may need to put more pressure on an existing tourniquet or consider putting a further tourniquet 5 centimetres above the first. Bandages. If the bandages are blood soaked, then apply a further bandage over the top, but never more than 2. If we get to the second, we simply cut off the 2 and replace with a fresh bandage.